Hi, my name is Casey Arrillaga. I am an author and clinician here at Windmill Wellness Ranch, a treatment center for addiction and mental health disorders. For most of human history, we've been aware of mental health, we've been aware of addiction, but we've treated them like they're two completely separate things, which we now know increasingly is simply not the case. So why do we treat them separately? And really it just comes down to the fact that for a long time neither one was terribly well understood. Like, we knew they existed, but we didn't know why. We might think that somebody had a demon. We might think that witchcraft was to blame. We might decide it was a moral failing. In fact, a lot of people still look at it that way. Well, if you just had more willpower, just buck it up, get out of bed, you don't have to be depressed, just get over your anxiety, why can't you just quit your addiction, things like this. And I can understand where people are coming from, but that's poorly informed from a scientific perspective. We now know that what is often happening is there is, in fact, medical, physiological dysfunction going on in somebody's brain. And if you don't understand that, then of course, from the outside, we're just going to look and say like, well, why do you behave that way? Whereas internally, often people are asking themselves the question, why do I behave this way? So whether it's depression, anxiety, bipolar, schizophrenia, addiction of any kind, which includes alcoholism, any of those things, the person who's experienced it is probably also asking themselves, why do I behave this way? And it turns out the answers for all of those conditions have a lot of very common roots. So how you frame a problem is going to have a lot to do with what kind of solution you come up with. So if you think this is just a moral failing, then what's the answer going to be? It might be religious instruction, moral instruction, lecturing, yelling at people, locking them up for bad behavior, things like that. That would be the solution if in fact it was just a moral failing. Now again, scientifically we know that's not the case. Now, if we think it's witchcraft, of course, you go after the witch, which gets some poor teenage girl in trouble. She didn't do anything wrong. Someone was actually experiencing physiological distress. So how we frame the problem, that's going to define the solution. And that's one of the big things we look at Windmill is as we get a better understanding scientifically within the scientific community, within the medical community, within the psychiatric community, within psychology and social work, then we can start addressing those problems with better solutions. So one of the things we now know is that about 40 to 60% of any of these conditions is straight up genetic. Now, there's usually not one gene that causes it. There's a cascade of different genes. They influence each other. So it's not like you have one gene and you're hosed or you have another gene and you're fine, but people are at greater risk. Now, those risks get significantly increased as people go through trauma, as they go through life experiences that are hard to handle. And again, it's not strength of character. Sometimes it's just luck of the draw. Nobody really likes to admit that. You know, one family member ends up in huge trouble and another one seems to sail through, or maybe they hide their anxiety better. But the reality is that some people are simply more vulnerable, and so we want to offer better help. Now, if we can understand that they've been through genetic things that are affecting the physiology of their brain, they've been through trauma and other experiences that have made addiction or mental health conditions much worse, then we want to start addressing those things, right? So at Windmill, right off the bat, we offer things like brain frequency, where we are directly working with somebody's brain to try and give them an edge. We do NET, which helps address some of the underlying physiological things going on throughout the entire body. And of course, we dig deep into trauma therapy. We offer both 12-step recovery and smart recovery, and a lot of our clients do both, so they have a wide range of recovery options. We do deep trauma processing. We do a lot of psychological work with people. So we hit it from all the angles, and of course, we work with medications. We try not to over-medicate people. Our goal is actually to have somebody leave on the minimum number of medications, but make sure that those medications are the right ones, and some of those can also be life-saving. So we're really hitting it from every angle to really match the scientific knowledge that we have today, instead of just going with old solutions that are simply done because they're tradition or because nobody had any better ideas. So one of the big pieces of jargon that you may run into within the industry is people talking about co-occurring disorders. And that's still kind of based on the idea that addiction is one thing, mental health is another thing. In reality, we know more and more that, again, they may be even just different facets of the exact same condition that somebody is struggling with. So for example, if someone is dealing with, say, bipolar disorder and they also have a substance use disorder, a lot of people just call addiction, then we could say, hey, which one do I treat first? When in reality, we're going to treat them both together. We're going to find the medications that would benefit both most at the same time. We're going to work on the underlying psychological issues. We're going to work with brain frequency, you name it. And between all those things, we're going to find the most effective solution for you or your loved one. If you're looking for treatment, you want to find someplace that has a modern understanding that treats the whole individual and takes all of these scientific factors into account. Is that treatment addressing the brain directly, like we do with brain frequency? Are they working with medications to minimize the number of medications and not send you home with a big bag or box full of medications that you have to take after treatment? Because frankly, most people won't follow up with that. Are you looking for some place that actually does scientific measurement on the spot as the client is going along, like we do with the Track 9 system, which is a really sophisticated way of seeing how people are doing in treatment and sometimes recognizing problems before they arise, before the client is even aware that they're there, so we can head them off and help that person in real time. Look for somebody that's doing all of that in the most ethical way, and you find good treatment for yourself or someone you love. You may not be able to control all the circumstances and all the mental health things that are going on with somebody, including yourself. However, you can take control over what you do about it. You can seek treatment, seek help, and make your life better, and through that, make the lives of everyone around you better as well.